All right, it is 12:30 Friday afternoon. It's time for our medical minute, and colorectal cancer is one of the most preventable cancers, yet thousands of cases are still diagnosed each and every year. Today on our medical minute, we are talking with a specialist about the latest screening guidelines, early detection, and what everyone should know to stay healthy. Let's welcome back to the news desk Dr. McGee. Welcome.
Hi, how are you?
I'm good, thank you. It's Friday, it's payday, and we're close to Valentine's Day as well. So,
Absolutely. Tomorrow.
yeah, tomorrow's
Yeah.
Valentine's, you bet. Okay, Doc, so let's start out with the basics. What is colorectal cancer, and why is screening so important for early detection?
So screening is so important for first question, what is colorectal cancer? So the colon cancer basically starts in the colon. So that's the part of the
Hmm.
large intestine, right? So we have our stomach, and then we have first we have the esophagus, then we have our stomach, then we have the small intestine, then we get to the large intestine where everything starts coming out, right? And so
Hmm.
in there is what we call our colon rectum area. And in that area, sometimes there's little tiny pockets that can form, and we call them polyps. And so these polyps basically grow into, after say 10 or 12 years, they can grow into cancer. So that's kind of, where the colon cancer starts from. Doesn't just start overnight. It usually takes time for those to grow.
Okay.
And it's so important because there's no early symptoms for us to know if a person has cancer. It's usually when people start having symptoms, that's whenever, we're running into problems, especially if they haven't gotten their routine screening for colorectal cancer. So it basically prevents this cancer from coming. The earlier we
Okay.
find it, the better it is for the patient.
And what age should most adults begin their regular cancer screenings for colorectal? I mean, guidelines recommend starting at age 45, but I mean, we just lost actor James Vanderbeek at 48. So, I mean, maybe we should think about
Absolutely.
something younger, right?
Absolutely. And the thing is that, like we just talked about, this cancer is preventable. It's preventable. People don't have to get this cancer if we do our screenings early. And one of the biggest, like you just said, average risk, we're looking at 45. However, this is for people who don't have any relatives, don't have any loved ones that, that have cancer or were
Hmm.
diagnosed. This is for those people that don't have any risk factors. People with risk factors, so I know that's one of your questions too. So, people with risk factors, we want to screen early.
Yeah.
So let's say, for instance, my father. My father was diagnosed with cancer in his 50s, right? So
Hmm.
what that means that before I get to my 50s, they want to screen me 10 years earlier than that. If your father was diagnosed when he was in his 60s, we technically want to do 10 years prior to that. So that way we're
Hmm.
finding that cancer earlier, especially with those who have that family history of colon cancer, because we know it's genetically sometimes passed on to, our next generation.
Okay. And screening options. Many folks,
Yes.
we've got different options to choose from. In fact, my father just went through one last Monday, the week of my birthday. And, everybody fears the big jug. I got to drink the gallon jug of the stuff. Everybody
Yeah,
fears it, but you got to do it. It's essential.
absolutely. Yes. And so there are some different options. So we have stool-based tests, right? Where a person can test send their stool in through, it's called a
Hmm.
FIT test, the fecal immune chemical test. There's a FOB test, which is a FOBT test. There's a DNA test, a FIT DNA, which is the Cologuard. So all of those are tested through stool. And then we have the other ones, which are like the visual ones, right? So then we have a colonoscopy, which is that
Hmm.
test where you have to, go drink that stuff. And then
Yeah.
there's this other one that's, a colography. So a CT colography basically takes a picture of that colon for the provider so that they can kind of see, okay, this is where, the way what we're looking at, or if they see anything in there. So the other one, so the difference between them is basically those, the ones that are testing like the fit and the stool-based ones, they're checking for blood. So they're checking for blood that's in the stool. If we
Hmm.
find blood in the stool, they're gonna have to get a colonoscopy. So,
Yeah,
there
you're going to
is
have.
no getting around the colonoscopy, even if you're doing those tests and screenings. They're great. We love them for some patients, but we know that, we still, if there's blood that we find in there, that we're gonna more than likely do that colonoscopy.
Okay, how often should we be getting these screenings? Of course, depending on the tests, I'm guessing, right? I mean, you could do the
Abs
Cologuard as many times as you want, I suppose, but
Yeah.
colonoscopy, that's a different story.
Absolutely. So basically with the fit, the fit and the fob, so those ones every year. So those ones are like a yearly screen. The colonoscopy is every 10 years. So that one is going to be every 10 years, as long as it's normal. If they find polyps or something like that, or if you have a higher risk, that number, closes down to a lower number. So usually
Okay.
it can go down to 5 years. If you have risk factors, we're going to go down to 5 years, and that's usually where they like to be with anybody with risk factors. So, and then the stool DNA, which is the Cologuard, that one they do every 3 years. But like I said, if there's blood in there, they're going to do the colonoscopy. The colonography, which is the one that they're doing to CT. Um, Now, if they do that one, which is like where they're taking pictures, they're just using a camera and taking pictures in the colon. That one is every 5 years. However, like I said, if there is anything that they find, colonoscopy is going to be occurring.
Okay.
So
Okay.
better just to get it. You know?
Yeah,
Um,
yeah, you might as well get it. You kind of touched on
yeah.
this a little bit earlier. Who is considered an average risk versus a high risk, and how does that change your screening recommendations? Say, yeah, as my father, and I've talked about this in the past, my father has colon cancer, survivor, and doing quite well,
Yeah.
thank goodness. Would I
Yay.
want to be doing the Cologuard, or would I rather be doing the colonoscopy? Which recommendation should we go with?
So, higher risk. So, if you're a higher risk, which you would be, right?
Hmm.
So, you have a first degree relative who had colorectal cancer.
Hmm.
You have a personal history, who had, these other issues. So, with that one, you would definitely need the colonoscopy. And that
Hmm.
probably wouldn't be an option. Just,
No.
just to be safe, just to be safe for you. I mean, you
Yep.
can go with those other options. However, more, your provider is more than likely going to be concerned and want you, like you just said, there's the average risk, right? There's average risk. Great question, by the way. These people have no history of colon cancer in their family, no history of inflammatory bowel disease, no history of any genetic problems, regarding the colon or regarding anything with their GI system. Those are the average people. So if you don't fit under that category, then we're already putting you in that high risk. And these are the people that have that family member who has a history of colon cancer. It could be a sibling, it could be a
Hmm.
parent. It could be a grandparent. And also, if they were diagnosed with the cancer before the age of 60, that's very important that we start screening early. If they have also, if there's a history of Crohn's disease or colitis or diverticulitis or inflammatory bowel disease, those are things that we like to get, that colonoscopy to make sure everything's okay, because with those conditions they can lead to a disruption in the lining of, that colon. And so that's why it's so important to also for them people to get that colonoscopy.
Yeah. Speaking of, let's say your different conditions, Crohn's or ulcerative colitis, how early should they begin screening? My best gal is suffering from one of the conditions, and she's approaching mid 40s. I think it's probably a good idea for maybe to go through something like this. I'm guessing, right?
Absolutely, and, going back, I'm gonna explain it, but going back to what you were talking about, the family history, like you were saying, starting at 45, but like I said, it's 10 years earlier if your father was diagnosed.
Yep.
And then
Hmm.
with the Crohn's, they wanna begin 8 to 10 years, early, once they're diagnosed. So once they get that diagnosis, we usually start doing the colonoscopies after that.
Okay.
Just
Okay.
because we want to be careful with them. Because, like I said, that condition causes a disruption in the lining of the colon, the walls. So we have to be careful with them and we want to make sure that we are checking them. And usually they may or may not go, between that, 5-year range, but it all depends on how much that it has affected them.
We've noticed over the years, over the past decade or so, if not longer now, maybe even 20 years, that younger and younger people are being affected with colorectal cancer. Any lifestyle changes that we could make on our end? Because when it comes down to food, you're eating the food that's available to you, really. But are there lifestyle changes that you can reduce to risk your chances?
Absolutely. That's such a great question. Like you just said, we have a lot of processed food, right? There's a lot,
Hmm.
McDonald's, Taco Bell, all of these wonderful places, Taco John's, which you guys have.
Yep.
All these wonderful places to eat, but we have to remember that that's all processed food. So definitely increasing the fruits and vegetables in their diet, having that salad once in a while. There's chopped salads now. There's so many options for salads. It's so important to eat those green, leafy vegetables and, get that fiber in your diet. Maintaining a healthy weight. You definitely, with processed food, like I said, it causes the body sometimes to store those the carbohydrates. And, you know, again, we're leading, like we talked about a few sessions before, into diabetes and high blood pressure. So changing their diet is so important. Doing regular exercise. Exercise helps everything move in the body. So it helps that digestive system get everything out too. And then, biggest ones, avoid smoking. Smoking
Hmm.
definitely increases their risk. If they have diabetes, make sure they're managing that diabetes. And, I would say, their alcohol intake, I think we talked about that last time, is making sure that alcohol intake is not excessive and it's more of a social, you know what I mean? Social drinking, because all of those are factors with, colorectal cancer.
Okay. And for people that are nervous about the preparation process, what should they know about how screening has improved in recent years?
So screening has improved. Yay. It really has. So, as you
Good.
said, your dad probably just went through this. And
Yep.
there's really a really awesome thing that they do now. They split the prep time. So sometimes they could start their prep before that colonoscopy the night before and then the next morning. So they kind of get a little break. Um, you know, and then there's also, the preps are lower volume. They're not as, like they used to be. Here's a gallon of
Hmm.
fluids. True,
Yep.
and really, in the hospital, I felt so bad for our patients because that's what we were giving them, lukewarm, So, we
Yep.
have better options now. They're better tasting options also. So, and then, people concerned, remember, they're gonna get sedated, they're gonna get medication, that's gonna help them sleep. One of my patients told me it was the best sleep they ever had. They woke up and they were like, "Oh, wow, it's already over." And they said the rest of the day, it was just such a great, peaceful, sleep that they were able to get. So I was like, well, this is a good thing.
Yeah, when I went through my process, which was about 5 years ago now, I had they brought me in the room obviously and got everything prepped, and they said count down from 10, and I think I got to 8, and the next thing I know, it literally felt like 5 minutes. And I think all in all, it
Yes.
was only maybe 20 minutes in the room, to be honest with you. It doesn't take very long,
Yeah.
but it felt like
No.
5 minutes. I was up, I was in the recovery room, and the whole thing really is preparing for it than it was the procedure itself.
Absolutely. The procedure is like 30 to 45 minutes. So it
Hmm.
is a really short time, and it's not too much of our time, right? Especially like you said, this actor who just passed from colorectal cancer. Um, it's really those screenings. We want to prevent this from coming in the first place. And sometimes people don't get those symptoms. By the time they're sometimes bleeding and we catch it, then we got to go in and probably, we don't know what's going to happen, because sometimes with these cancers, they can be aggressive and they can start to move to other organs. And
Yeah.
so we just want to make sure we're doing those screenings, following that advice. If your family member has colorectal cancer, it's so important for you to get screened.
Okay. Doc, if someone's watching today that hasn't scheduled their screening yet, what's the most important thing that you want them to take away?
It saves lives. Getting the screening will save their life. And, we all want to grow old and we want to walk those children down the aisle, or, do that fishing when we're retired, right?
Hmm.
Or
Yeah.
whatever it is we want to do. And this, screening, it saves lives and it prevents the cancer. So it's not 30 minutes isn't too long to spend to save your life.
You bet. Well, Doc, thank you so much for the insight. We appreciate it. And any plans for Valentine's Day?
Yes, I'm going to my favorite restaurant, Michael Jordan's in
Oh,
Chicago. Yeah.
okay.
So, yeah, it's
What?
they have the best mac and cheese.
Okay. I was going to ask what kind of dish you're thinking about having when you go there. They got steaks, I'm sure. Is it a steakhouse or something?
Yeah, it is a steakhouse, but honestly, I love their sides. They make the most fantastic sides. And so so that's my splurge that's my gift to me. To
Okay. Good for you.
eat a little bad. Yep, I worked out all week, so I get to get that little splurge in. But yeah, they do have excellent steaks too.
Okay. Yeah, we're going to be going to a Brazilian steakhouse ourselves tonight for Valentine's Day. So that's our plan. Well, you enjoy, okay, and take care. And we will catch up with you in a couple more weeks.
All right, all right, great Valentine's Day. All right, bye.
Thank you. Bye bye. All right, 48 minutes now past the hour. Quick break here at the news desk. We're back here at the top of the hour with more.